Well, we're going to get an update of what's happening in the Congress now because, I tell you what, it was delight about a week or so. I was in Orlando, as I was sharing with you a few days ago, for the Florida Family Policy Council annual awards dinner. And, of course, you get a chance to just spend some time outside the legislative arenas with so many of the elected officials I work with on a daily basis. But one of my greatest mentors is my next guest, and that's Daniel Webster. And I want to tell you that for years, he's been a family man. His family business has been the air conditioning business. He's been a citizen advocator all over Central Florida in all the different levels of service. And tell you what, he's just known to everyone, Democrats, liberals, Republicans, you name it. A lot of respect for Dan Webster because of the way that he conducts himself and his tremendous integrity. He served as a Speaker of the House as well as a Majority Leader in the Senate. That's where I had a chance to learn a lot from working with him and watching him. He actually redid all the rules in the House for more fairness, and most of those rules are still standing today. In the 117th Congress, he will continue serving on the House Transportation and Infrastructure Committee, the House Committee on Natural Resources, along with Science-Based Technology Committee, and 35 years of transportation experience. I tell you what, I'm honored. But the thing I love the most, and I know his pastor, he has been a member at First Baptist Church of Central Florida for years, probably decades, but years and years and years. And he is the quintessential citizen representative, but big time family man. His faith, Jesus Christ, is very important to him. Congressman Webster, good to have you back on the Bill Bunkley Show.
Great to be on, Bill. Great to talk to you. Great to hear your voice. It was good to see you the other night. Yes,
it wasn't. It was indeed. Now, can you sort things out for me before we talk about your new health care plan? We think, well, let's put it this way. You're starting to run in a new district because they've been rewritten. It's up, it's on, it's off, it's on and off. What do you anticipate to be your new district?
My new district is different than the old. Matter of fact, I sort of moved back from where I was 8 or 9 years ago. I have pretty good bit of Orange County. So, let's see, Lake County, Sumter County, and just a teeny part of Polk. Far different from what I have today, other than the base of in the central area, which is Sumter County and Lake County.
Well, I'm excited because with our new Central Florida coverage here on the Bill Bunkley Show 3 hours a day, every one of those counties are now counties that I have a chance to speak into every day. And folks, you can rest assured that when the time comes and I start giving you my recommendations, that Congressman Webster will be my recommendation to be returned to Congress. But that gives you that little bit of idea because it's a little confusing. I won't go to it now. We got lawsuits. I think the Supreme Court will probably, hopefully, side with Governor DeSantis, but they need to get that resolved so these public servants, potential public servants, in Daniel's case, to return, can get going. So healthcare is among the many crises. I mean, Congressman Webster, we got Russia, we got China, we got COVID, now we got monkeypox, now we got gas, now we got inflation. But healthcare is someone that's getting up there, myself, concerned about healthcare. Healthcare and long-term healthcare is something that really needs attention. Tell us what you're doing because you've got a bill that you have filed in this very area.
Yeah, well, this bill helps more people, more Americans have access to the care they need from the doctor they choose at a price they can afford. Those are the three principles I think we need. Provide the tax deduction to healthcare providers who pro bono give pro bono services to individual families who will rely on Medicaid and CHIP for their health care. So it's a simple bill, but everyone wins. The government saves billions. The doctor or nurse or whoever the healthcare provider is gets a tax deduction, and the person gets health care. And I think that's it.
when you talk about elder citizens of the country, and when you get into not only Medicare, but Medicaid, the revisions are so important to have a holistic approach to long-term care because, even right now without these incentives, Congressman Webster, a lot of doctors don't want to participate with Medicare, much less Medicaid. And with the growing baby boomers that are expanding every day that are going to need these services, something has to be done to provide an adequate playing field for some of these doctors and others to take Medicare, Medicaid patients, but they're not right now because it's not real fair what they're going to get compensated.
Right. So I think offering pro bono health services and to the provider, though, a tax deduction, which will help them greatly, will hopefully solve some of that problem.
I think the tax deduction is pretty important. What is the mood right now? Because you are, it's almost like you are working. Let's just say that you and your party right now, under the current leadership of Speaker Pelosi, oftentimes you don't have a lot of options, but you have always been one of a real gentleman's demeanor. Everyone knows about your walk with the Lord, and for years, many legislators and now Congress people, I know that, they get in a bind or something's going on, they need to get some advice, they come to you for that. Is that part of what you're hopeful in trying to cross the aisle with those on the other side to get some progress on this bill?
I think, as far as I'm concerned, I want to get something done. And there may only be a handful of things we can do, but this is one of them. And if it doesn't make it this time, we'll try next time. But to me, this is a prime example of something that everybody could support.
Now, in addition to this, we got a couple of minutes left. Anything else that you're working on or something that you would just like to mention to your constituents who will be listening in today?
Well, I'm working on a bill I've had for a couple of years, and it almost made it this time, and maybe it will next time. It's still around. It's a infrastructure bank for infrastructure like roads and bridges and so forth for every state, and it would be funded privately. No cost to the federal government, no cost to the local government, no cost to the state. It just would be something extra money, new money, but yet the none of the government would be on the hook for anything. There'd be nothing if they fail or anything else. That would all be left to the private sector. And there's people who are willing to invest in those kind of things. So it's an opportunity we can have, and we're going to try to take advantage of it.
All right. You've been listening to Voice of Florida Congressman Daniel Webster, Republican from Clermont. And the bill is the Helping Everyone Access Long-Term Health Care Act. And his quote is, "This bill helps more Americans to have access to the care they need from the doctors they choose at a price they can afford." Let's get behind this bill. Congressman, hey, good to talk to you. Good to see you again. God bless you, my friend. We'll see you down the road.
God bless you, too. Thank you, Bill.
God bless you.